Good afternoon. It is Friday. We've made it to the end of the week. Hopping on to share an update of what I'm working on here in St. Paul for the second half of the week. I did another video about the first half, so I'll just talk about the second half. 4 bills I had in committee the second half of this week. And I'm going to look at my whiteboard so I can be sure to get them all. One was around P-TECH, which is an excellent program that we have in Rochester Public Schools. And big thank you to Superintendent Dr. Kent Pickel, who testified on this bill. This is a program for our high school students to get into career pathways that are needed in our community, good paying jobs that are needed. Healthcare and IT are our two pathways. It's a partnership with higher ed, with RCTC. Excellent program. The bill would grow that pot of money, the resources, so other school districts can take part and build their programs as well. And Rochester has agreed to be a resource and partner with those schools to share lessons learned. A great opportunity for kids to get education into pathways that are needed and that they choose to do. So that bill was heard in Ed Finance. On 2 bills, I had in HHS, Health and Human Services, around mental health care. One of them was around a collaborative care model, which is a model that is being used in some parts of the state that integrates mental health care into primary care. It is useful for patients, it is cost effective, it has proven good outcomes. This bill would allow that collaborative care model to expand to other parts of the state. The second bill around mental health care I have is not related to funding, but is policy only and related to eliminating some of the barriers, the red tape, the processes that don't bring value, to allow providers who are doing that critically important work to spend more of their time delivering that care and less time checking boxes and doing paperwork and sending things here and there. And so it's a good bill. Really to enhance care for Minnesotans and decrease some of that procedural things that don't bring value. And then the last bill I will mention, I had in state and local gov, and that is around, I've spoken about it before because this is our second stop, a bill that would allow a working group to look at campaign finance for local candidates. Where should they report to? Currently they report locally. This study group would look at, should that really happen centrally through the campaign finance board? So a few of the bills that I had heard in committee this week. Things are moving. I also had great meetings with constituents and different groups. I always say I love it when I meet with folks from Rochester and St. Paul. I also love talking to healthcare folks, and so I had a number of those meetings where those things intersected this week, which is great. If you would like to connect, please reach out. I'm happy to do that either here in St. Paul or in Rochester, or send me an email. I read all of those and do respond, and so great to hear from all of you. I know there are lots of folks with concerns right now. I'm going to make a second video about some of that, so stay tuned for that. Have a good weekend. Talk soon.